Today we're going to be covering part one of a three-part series where we talk about the different disorders of the circulatory system. The three different parts are going to cover disorders of the blood, disorders of the blood vessels, and disorders of the heart. Today we're going to be talking about disorders of the blood. The first disorder we're going to be looking at is anemia. Anemia is a condition in where you lack enough healthy red blood cells to carry the adequate oxygen to your body tissues. The most common cause of this is low iron levels in the blood or low hemoglobin levels. Symptoms can include fatigue, pale skin, shortness of breath, feeling lightheaded, dizzy, or having a fast heartbeat. The treatment will depend on what is causing the anemia, but most commonly, iron supplements may be used to help the iron deficiency. Vitamin B supplements may be used if you have a low vitamin level. Blood transfusions may be used for loss of blood, and medications can be used to help induce blood formation or may be used if the body's blood production is reduced. On the left-hand side, you can see what an image of the normal blood would look like. And then at the bottom, you can see the image of an anemic blood type, where they have less red blood cells circulating and therefore less oxygen. Sickle cell anemia is a disease from an inherited group of disorders where red blood cells contort into a sickle shape or half-moon shape, as you can see on the left-hand side. The cells die early, leaving a shortage of healthy red blood cells, known as sickle cell anemia, and can block blood flow, causing pain, which is known as sickle cell crisis. This is caused by a group of disorders that cause the red blood cells to become misshapen or eventually break down. Symptoms may include frequent infections because they have a lower or weakened immune system, pain, and fatigue. Medications, blood transfusions, and rarely a bone marrow transplant may be used to treat sickle cell anemia. Something interesting about sickle cell anemia is that the most prevalent cases are among African or African American populations. About 1 in 13 Black or African American babies are born with the sickle cell trait. On the bottom right-hand side of the screen, you can see here where two parents are both sickle cell carriers of the trait. If they were to have 4 children, you can see 1 would be typical, meaning no blood disorder, 2 would carry the sickle cell trait, and 1 would have sickle cell disease, meaning that if both parents are sickle cell trait carriers, there's a 25% chance that they will have a child with sickle cell anemia. 100,000 people in North America have sickle cell disease. 1 in 365 African American children will have sickle cell disease, while only 1 in 16,300 Hispanic American children have sickle cell disease. Sickle cell anemia is an inherited disorder. 100 million people worldwide and 1 in 12 African Americans, or 3 million people in North America, have the sickle cell trait and are able to pass sickle cell disease to their children. Next, we're going to look at embolisms. An embolism is a sudden blockage of an artery. The primary cause of an embolism is a deep vein thrombosis, a condition in which blood clots form in large veins of the lower extremities, such as in the thigh or the lower leg. If the blood clot breaks free from the wall of the vein, it can travel through the bloodstream and cause an embolism by blocking an artery. In the image here, you can see the embolism moves through the bloodstream until it becomes too narrow to pass through, causing a blockage, therefore blocking the flow of blood. Symptoms can vary based on the site of the embolism, but generally involve sudden dysfunction of the infected organ due to the lack of blood circulation and oxygen that is reaching the tissues. Treatment will also vary and can include things such as blood thinners, clot-busting drugs, procedures, and surgery. Hemophilia is a disorder in which blood doesn't clot normally. When blood can't clot properly, excessive bleeding, either external or internal, occurs after any type of injury or damage. For example, if you were to get a minor cut, your blood would clot pretty quickly and you would be able to move on about your day. Someone with hemophilia might get a minor cut and have trouble getting that cut to heal on its own and may require some extra medication or medical attention from a doctor. The cause of hemophilia is a mutation or change in one of the genes, meaning it is genetic. This provides instructions for making the clotting factor proteins needed to form a blood clot. This change or mutation prevents that clotting protein from working properly, or in some cases, it may be missing altogether. These genes are located on the X chromosome. Many large or deep bruises, joint pain and swelling, sometimes unexplained bleeding, and blood in the urine or stool are all common symptoms of hemophilia. Treatment may include injections or a clotting factor or plasma. Here on the left-hand side, you can see a normal blood vessel. The bleeding starts, and in a normal person, clotting factors would come to the site of the injury and clot so that they no longer bleed. In someone with hemophilia, that fibrin clot is incomplete and the bleeding continues. On this image, we can see if the father has hemophilia and the mother is not a carrier of the hemophilia gene, there is a 100% chance that their daughters will be carriers of the hemophilia gene, specifically daughters because it is carried on the X chromosome. If the mother is a carrier of the hemophilia gene and the father does not have hemophilia, there's a 50% chance that they would have a son who does have hemophilia and a 50% chance they would have a daughter who carries the hemophilia gene. Lastly, we will look at a thrombus. A thrombus is a blood clot that forms on the wall of a blood vessel or in the heart when the blood platelets, proteins, and cells start to stick together. A thrombus may eventually block the flow of blood completely in that vessel. Most likely to occur in people who are immobile or with those with a genetic predisposition to blood clotting. A thrombus can also form after some type of damage occurs in an artery, vein, or surrounding tissue due to trauma. Symptoms may include swelling, changes in color or pain in the site of the thrombus, pitting edema, which is swelling that is able to form dips or pits when you push down on it, cramps, and possibly trouble breathing if the thrombus has moved to the lungs. Treatments will include anticoagulant medications such as blood thinners known as aspirin, clot buster medications called thrombolytics, and compression stockings, exercise, and possibly surgery.